Hi, this is Sue Schmidt. Today we will be having a webinar on creating engaging remote web-based labs. Our presenter today is Dr. Farah Bennani, and Farah is the college-wide chair online learning for math, science, allied health, and psychology at Front Range Community College. Farah is also the curriculum lead representing allied health in the development of the NANSLO lab activities for the CHIO initiative. And as you can see, she has a great deal of experience not only in the lab development work, but also as a faculty in science, math, and allied health. As you know, this webinar is being funded by the U.S. Department of Labor. With that, I'm going to advance to the next slide, and I'm going to turn it over to Farah.
Good afternoon. Thank you, Sue, for the introduction. Thank you to anyone who's able to join us. So today's topic, as requested by Sue, I will be sharing with you how whether developing biology, but by Kate Lorman, who's with us today in the webinar, as well as one that I developed under the allied health curriculum. We basically follow the same outline in terms of how we perceive that, what the experience that the student needs to have. For today's webinar, the outline, as you can see them on the slide, I will discuss how we identify the lab learning objectives, how we go about selecting the background information that we ask the student to read to give them an overview of what will be covered. We make sure that the learning objectives basically follow and drive the sequence of any type of activity that we select. And then we'll share with you basically in the labs how we decide what kind of questions that we put in those labs. And all of us, whether under biology or allied health, we follow the inquiry-based model, and I will discuss mainly the reason behind this. And at the end of the lab, whether the one that I developed or the one developed by Kate under biology, we have formatted questions, and I will explain the reason why we have chosen to go with this in this route if you want, and why the summary are more summative. So to start with the first outline that I have, so basically the way how we select those, or I will speak for the one that I developed, and I'm sure Kate does the same thing. The learning objective, basically, the idea is, what do I want my students to know at the end of this lab once they finish? And the second thing that I think of is, okay, what type of lab experiments I am asking them, or I think will be feasible in the remote lab setting, and at the meantime, keeping in mind the time needed for them to finish each one of those procedures, and precisely what specific learning outcome I need the student to acquire from each one of those procedures. So in identifying the labs, we also, I also keep in mind that the selected learning objectives, they need to be constructed in a meaningful assessment. And mainly because we as faculty, we want to be able to ask the students to demonstrate that they have achieved the learning objective. At the meantime, this will help us determine the progress of the skills and the development, at the meantime adding to the content understanding. So, for example, all of those learning objectives basically follow the frame around the acronym SKA, which stands for skills, knowledge, and the attitude. So in the skills, basically, it's what I covered in the previous slide. What students should be able to do after finishing the lab? And the knowledge, basically under the first one, what do students need to know, and what understanding by the end of the lab we want them to have. As for the A, again, just to remind you, the acronym is the SKA. The A stands for the attitude. So basically, we're keeping in mind what student opinion will be at the end once they finish this lab. Will they like it, hate it, or will they be encouraged to even research further information related to each one of those labs? The second one is mainly selecting the background. Now, keep in mind, when we develop those labs, we have no idea what faculty member is covering during the lecture, We do not know what courses those will be used for in terms of anatomy, physiology, or pathophysiology as an example, nor we don't have any idea what textbook is done. Also, we keep in mind in some institutions the TA is mainly the one doing the lab, and sometimes there is a disconnect between what is covered in the lab and what is covered during the lecture. So we're trying to think of, okay, what will be the best solution to convey all of those obstacles, if I can use the word, to help the students. So we try to provide the information and the background information to the students to cover basically all the information that they need to can go ahead and read the lab and right away to be able to do the lab and know exactly what we're talking about or what is the purpose of this procedure. So basically that's the rationale behind the information, and it's mainly because we also ask them some questions related to precisely some of the background information to make sure we're reinforcing that they have read the information and there are questions so they can close the loop. So to ensure that the learning objectives are the one that drive, so once I decide what is the objective, again, I keep in mind the time needed to finish each one of those activities in the remote lab setting. And usually, overall, all the labs that have been developed under allied health as well as the one under biology are on average between 1 hour and a half to 2 hours. Again, each faculty member is free to custom and be specific once they schedule the lab what procedure, or they can remove some exercise depending on the need of the students and based on what the faculty member basically choose to have in his or her class. In each one of those questions that we have, in each one of those labs, we do have questions, and all those questions are basically constructed using an inquiry-based model. The main reason, as we all know, education begins with the curiosity of the learner. We know that the inquiry-based model is student-centered. We mainly focus on the how rather than what, so we do not just lecture, but we try to entice the students in terms of how they be willing to learn how to investigate something related to the lab. We emphasize on the development of the skills and initial inquiry attitude for them. We want them to develop the critical skills, as I mentioned, as they go from one lab procedure to another one. We want to help the student learn to develop these learning solving skills, which is basically one of the main things that they need, especially in the 21st century. And if you go to the NSA and other different types, and NCA, not the NSA, and basically if you go over the main requirement needed, especially to be a digital learner in the 21st century, it's one of the requirements that is needed. So basically, we want the student to learn things rather than about things, and the way how those labs are developed through the investigation process. So the questions are basically the way how we write them are in a sequence. Again, want them first to read the information, to build the knowledge, and then we want them to use the information provided to them to be able to answer those questions. As we know, the inquiry approach is more focused on using the learning content as a means of developing of the information processing, as well as the problem-solving skills. We also want the student to be more engaged and be able to be involved in the construction of this knowledge. So that's why it's more hands-on experience, it is more inquiry-based and more this investigation process. And the main purpose, as we all know, the more actively engaged are the students, the more they will acquire the depth of knowledge. And also this will increase the achievement. And we're hoping this is what each student basically doing those labs will be able to acquire at the end, again, through reinforcement and, of course, the information provided to them from their faculty member during the lecture time. So the questions that we have also are summative, and basically at the beginning of each lab, before doing any exercise or any experimental procedures, when appropriate, so we do have pre-lab exercises, so the students are required to read the information given to them in the background information. And once they start the lab, when appropriate, depending on the labs, as you have probably guessed, some will be asked, we ask the students basically to formulate a hypothesis before starting any procedure. Again, with the idea in mind, we want them to develop this critical thinking process and inquiry base. During the lab exercise, again, they learn how to gather the data, and depending on the lab that we do either measurements or data collections, do the graph, and then we close the loop by asking them to check the results and to find out if they are in correlation with the prediction that they have provided in the hypothesis, and then either to accept or to reject basically what they have written as part of the hypothesis using the new data collected from the lab. At the end of each lab, each one of the lab basically have summary questions, and those can be broken down in two different types. So usually some of them will be kind of reinforcing, recall information, or asking for definitions or summarizing the information. And the purpose from this is mainly to reinforce what was covered during the lab. And then we go to deeper information, and we ask them in-depth applications. And the main purpose behind this is mainly to broaden the student perspective, again, to develop the critical thinking skills, and to be able to tie the different parts of the puzzle to be able to see the big picture. So each one of those exercises have been selected for specific reason, and we try to emphasis on it basically by asking those summary questions at the end. And since I will speak for the allied health curriculum labs that I developed, the idea behind each one of those labs, whether for the exercise or for the lab, the summary questions will have information in terms of, okay, at the end, they need to apply this information, but then again, broaden the information and investigate something else. And the purpose behind is the body functions as an entity. It's not just one system acting on its own. So there's always this connection that the student need to have anytime they're studying any type of this or doing any type of those labs to kind of to close the big loop, if you want. So for example, in some lab we ask them to provide suggestion on how they will investigate specific conditions or specific topics. In some labs, we ask them to research other conditions or disease related to information that was covered in the lab. In some lab, I use scenarios similar to real-life situation, and the idea behind it is trying to make it as epistemic as possible. And the question for them is basically, okay, you have this case study or this scenario that maybe one day will end up being in this situation, or depending on whatever health field you be pursuing in terms of your furthering your study, how would it go by investigating this situation? So to illustrate what I have covered, so basically this is how I follow basically every time I develop any one of those allied health labs, and can use the same inquiry base as well for the biology lab. And I have chosen one of the labs that I have developed, and just to go through it and run with you each one of those exercises, and just to show you an application of exactly what I was covering earlier. So for the example, I have chosen the hematology lab, and for any faculty member teaching anatomy and physiology, so it is or pathophysiology. So those are key labs done in almost any anatomy and physiology lab. So the learning objective that I have developed for this one, by the end of the lab procedure, the student should be able to know the function of each one of those formed elements in the blood. The student needs to identify and distinguish between the different kind of formed elements, to be able to measure the relative size of certain cells, and to be able to fulfill this third objective as an example, in the lab procedure, they do have one procedure where they will be required to use the micrometer and to be able to measure. Again, it's more an application on how to use the micrometer and at the meantime collect data. So they're doing basically two things and acquiring the skills at the same time. The fourth objective, I want the student to identify, distinguish, and be able to measure the size of healthy red blood cells versus the one with sickle cell anemia. And mainly, again, we have these compare contrast, and at the meantime, we also ask them to, again, the same thing that they have done in the previous one using healthy red blood cells. Now let's do the comparison. So they have a visual to be able to compare just what is different between these two different types of cells, but at the meantime collect data and be able to measure. Another objective, we ask them to identify and distinguish and measure the size between red blood cells and thalassemia measures one. Again, another pathological conditions, and we have the slide and want them again to be able to compare and contrast between the two and report the data. We do the same thing for the white blood cells, so I want them to be able to measure the size of the different types of white blood cells and compare them to the infectious mono slides. And at the end, like in most of the hematology labs, so we talk about the blood, we talk about the blood typing, and they need to be able to figure out the matching of the blood donor and be able to appropriate the blood donor to a given recipient. And again, keeping in mind that most of the students taking those classes will end up in the allied health field, so it's a good experience to be exposed to this information, and it's part of the curriculum in every 2 or 4 year institution. So here are the list of exercises.
I do hear a something. So if you are using please mute your computer speakers because it tends to reverberate the sound. So if you could do that, I would appreciate it. Sorry, Farah. Thanks.
No problem. So the list of exercises selected for these labs. For the first one, they will look at the microscopic examination of the different types of blood cells. The second one, again, in each one of those questions, they will have the pre-lab exercise. We ask them to formulate hypotheses and then do the observation, take the pictures, take the measurements, and then go back and either accept or reject what they have provided under the hypothesis. They do the same thing for exercise number 2, again, reinforcing the skills of learning how to use the micrometer and collect the data. They will do it again now, comparing the red blood cells, normal red blood cells, and the sickle cells one. They do the same thing for the third exercise, and we ask them to compare the difference between the red versus the white in terms of size as well, and compare them with thalassemia, and they do the same thing for the infectious mono. At the end of the lab, the last exercise, there's an ABO raises plus minus blood typing exercise. And again, all of this information is available for them to be able to answer those questions based on the selected background information. They have all the information. Even though the faculty members still did not cover the blood, they have all the information to be able to answer all of those questions, know exactly what the lab will be talking about, and guide them throughout this lab procedure. So here is an example of summary questions that are provided in these labs. So again, to reinforce the information and to make sure they have read the background information, the first question asks them, which of the following elements we collectively refer as the granulocytes? The second one, okay, now they have to provide the information regarding the agranulocytes. And since we talk about the blood typing and we talk about the function of the white blood cells, there is a background information on immunology. So the third question asks, as an example here, what is the difference between an antigen and antibody? And for any one of us teaching immunology or anatomy and physiology, you know how the students sometimes confuse these two. So that was the purpose of reinforcing the information. So as you can see, the previous questions were mainly, okay, you have read it, you can go back and flip the pages and be able to answer those questions. And you have done the lab, you can answer the information based on what you have gathered. The summary questions are more in-depth, and so as we go further in selecting those questions, so here's the one that, again, this lab, just to remind you, this lab has more than 3 questions. I just randomly selected those just to show the application of what I was talking about earlier in the webinar. So for this third question, so they're given a scenario. A patient is admitted to the hospital. One of the first procedures for health professionals is to perform the blood draw. One of the lab value is mainly to check the level of the white blood cells and the count of white blood cells. And if it's elevated, usually this indicates the inflammation. Again, we're trying to make it as epistemic as possible, but at the meantime, tie the information. You have studied the white blood cells. You know the background information. Now, you have seen them under the microscope. You have taken pictures. You have measured them. Now, let's apply the information even further to broaden your information. And so, further analysis for this particular case study that we have indicate the prevalence of the different types of white blood cells and potential cause of the inflammation. So we're asking the students to go back and research. Now, they can use any information that they have. They can use their textbook. They can use the internet and report back to their faculty member or whomever will be collecting the information for the lab. So the information that they have together is, okay, if we end up having neutrophils as elevated in terms of this profile of these patients that we have here, they have to provide an explanation of their reasoning. What happened in the case of the lymphocytes, and do the same thing for the eosinophils. Now, none of these information with the background information will not be helping them to answer the question. The background tells them what is the function of each one of them. Now we're tying it to even further application in terms of, okay, we have an inflammation. Now it is their job to go and find the information. What happened in terms of if there's an increase one versus another one. And the reason behind this, the increase of one versus another one, as an example, will depend, are we dealing with a viral infection or bacterial infection, among any other type of infection that could happen. So the idea is back to what I mentioned in one of the slides, is to have all of this information and look at the big picture and be able to gather this information. And now, okay, we're not just talking about white blood cells and this is what they look like. It's more of, okay, now there is a baseline, there's a normal count. Let's learn if there's an increase or versus decrease in any one of them, and that's the purpose behind the selection of those type of questions. Now, each one of the allied health lab that I have developed, they're following exactly the same procedure that I explained. Same thing for the biology. We start with kind of somewhat easy questions, and as they go further in the lab and at the end of the lab, we make them even more inquiry-based, and for the purpose of, okay, now you have to go beyond and research the information and develop the critical thinking to be able to provide the information in this documentation we're asking you to do. And at the meantime, okay, now go beyond. You have done this lab, let's go beyond and research further information. Thank you so much. That's what I have. So we have plenty of time, so I'll be happy to answer any questions you may have. You feel free, please, to either type them or use the microphone if you have any questions. Hi, Brenda.
Farah, just as information, I think you know Brenda is the lab manager and also faculty at the Great Falls College. So
yes, yes, we met in last June, last May.
That's what I thought.
Yes, yeah.
Perfect. Does anyone have any questions in relationship to this material? If you do, please either post that question in the chat area, Or if you are using the telephone, please feel free to use the telephone to ask your question, or if you are using a microphone, please use the microphone. So we'll open it for just a few more minutes for questions and see if there are any.
Awesome job, Farah. I've got to run, but you did fantastic.
Thank you. I appreciate the feedback. Thank you.
All right. Well, with that, I think we will close this webinar. And I want to thank you, Farah, for taking the time to present the information today on how you create a lab activity for your students in your allied health courses. So thank you so much.
Thank you. I appreciate the opportunity. And for we're asking all the faculty members, all the labs that have been developed, they are in the listserv, and we appreciate if you can read them, provide us with the feedback, and we'll be happy to make any modification needed to suit your students as well as your curriculum. Thank you so much. I appreciate it. Thank you, sir.
Thank you, Farah.
Bye.